Welcome to Genomics Now, a podcast series where you can learn how genomics is developing in England's NHS. This podcast series is recorded in 2024 and is part of the North Thames Genomic Medicine Services Educational Toolkit. In each bite-sized episode, we explore what is changing in genomics. We answer the questions on genomics we've been asked by the different healthcare professionals. We talk about the ways genomics may impact different healthcare roles and how genomics can be used to successfully improve patient care. Hello, I am Dr. Shazia Mahamdallie, and I'm part of the North Thames Genomic Medicine Services Workforce Education and Training team. In today's episode, I'm thrilled to welcome three incredible guests, Mark, Janet and Gini. Each of them brings personal experience with lung cancer biopsy testing, and they're here to share their unique journey. First, Gini will kick things off by explaining what a liquid biopsy test is. Then Mark will share his experience, having undergone several private liquid biopsy tests before the NHS pilot programme began. Lastly, Janet will take us through her experience as part of this groundbreaking study. After Gini's introduction, I'll pass the mic to her to lead today's discussion.
A liquid biopsy is a simple blood test that looks for small pieces of DNA from cancer cells in your blood. This test can find changes in these DNA pieces, called genetic biomarkers. When cancer cells are found in the blood, it's called circulating tumour DNA, or ctDNA. By studying ctDNA, doctors can learn about the cancer and the possible treatment options. Since a liquid biopsy is a blood test, it's less invasive than traditional tissue biopsies where a piece of the tumour is removed for testing. This liquid biopsy test is being tried with some patients suspected of having lung cancer because it offers a simpler way to get important genetic information about the cancer. This test can give results before a traditional tissue biopsy, helping patients and doctors choose the best treatment sooner.
I'm Gini. I'm a trustee at EGFR Positive UK, which is a charity that supports people with EGFR positive lung cancer. And I just wanted to start really by talking to Mark a bit about your experience. So what led you to your diagnosis? What symptoms did you have, and what was your journey from there?
So I was diagnosed initially about 12 years ago. But what led to the diagnosis was I coughed up a bit of blood, and it didn't happen subsequently. But my GP took it seriously and moved me on from X-ray to CT scan to more investigations, and it turned out that it was a small lung cancer.
What stage were you diagnosed then when they got to you?
I was a stage 2.
Okay, so they did get you quite early, which is brilliant.
Yeah.
And how were you initially diagnosed with the EGFR lung cancer?
So they did a biopsy of the lung cancer, a physical biopsy, and they came back with EGFR exon 19 deletion.
Okay, so then after you'd had your initial diagnosis and had initial treatment, you then had some experience with liquid biopsy. What led you to want to have a liquid biopsy? What was your experience with that?
So approximately a year and a half to 2 years after my initial diagnosis and lung operation, I started having difficulty speaking. And after a few scans, they found that there was a very small node that they couldn't explain near my esophagus, which was also pressing against one of the focal cord nerves. It was in a really awkward place from a biopsy point of view, and they couldn't guarantee that a physical biopsy would produce anything of relevance and of interest. So I went for a Galvin 360 liquid biopsy at that point.
And was that something you found out about yourself, or was that something that the medical team told you about? How did you find out about liquid biopsies?
I think it was my mum who worked as a pharmacist previously, who researched the liquid biopsy. And when I took that idea to my oncologist, he said, "Oh, yeah, they're definitely a good company to do the biopsy and to provide information."
Because that must have been quite a wee while ago now, was it? Because it's only sort of recently that they've started to become more of a almost mainstay of treatment and explorations in different countries, and also now in the UK. So a little while ago, how much information did you get about liquid biopsy before you went for it?
It was purely from Garden themselves. I've been from my oncologist as well. He knew of them. And so I was fairly confident that as long as there were cells moving around in my blood that were cancerous, then there was a reasonable chance that the liquid biopsy would pick up something.
And did it?
And it did. It turned out that I have a submutation of EGFR, which is T790M. And so my oncologist was able to immediately put me on to Tagrisso to treat that, and it went away.
Thank you, Mark and Gini, for that information, and Mark, for you telling us your story of your journey. For our listeners now, I wanted to give a little bit of information on the lung cancer pilot program for liquid biopsy testing, and then I'll hand back to Gini.
The NHS pilot for suspected lung cancer. There are different types of lung cancer, with non-small cell lung cancer being the most common. NHS England has started a pilot programme supporting liquid biopsy testing for patients with suspected late-stage non-small cell lung cancer. Over 2,000 patients have already agreed to have their blood tested in this pilot. The liquid biopsy results can come back before traditional tissue biopsies, allowing earlier discussions about treatment options and clinical trials. The pilot is now expanding to include 10,000 more patients across many hospitals in England.
So thank you, Gini, for making that recording of that information for us, and I'll hand the mic back over to you.
Thank you. So we're actually now going to talk to somebody who was part of the pilot that was just talked about. So Janet, could you just give us a little bit of a story about what your experience has been, both in terms of the symptoms that led up to diagnosis, your diagnosis experience, and then sort of how that informed your treatment?
I'm a bit further down the line, if you like, from where Mark is. So I was only diagnosed in July. I'd actually been really well up to the end of May, feeling fighting fit, been off doing sort of digging on a archaeological dig for 2 weeks, which is heavy work, 6 hours a day, no problem whatsoever. Then came back from that, and the first thing I noticed was I started feeling a little bit breathless. Went out for a walk, whatever. And then I got a cough, and yours was cough from heart. I've got one of the things I've got is I've got asthma, so I assumed it was I'd got a viral infection and got an exacerbation of asthma. So I was in and out from the GP on steroids, antibiotics, whatever, making no difference at all to. Whereas normally I would have no problem with my asthma, or it would respond quickly to something. I hadn't had to have all the steroids for 15 years, I think it was, last time I needed to have them, and none of it was having any impact. Because of the nature of the cough, I was up all night coughing, and it was really cough, and feeling sick at the end of it. And then after about 3-4 weeks, I saw the nurse in practice, and she said, "You know what, you've had steroids, you've had this, that, and the other. I think you need to go for a chest x-ray." The other thing I had noticed is I had got, and I've mentioned this GP, is I found some lymph nodes in my neck. And just on on one side, which was quite unusual because, sort of infection stuff, you tend to get them all over the place, don't you? But they basically said, well, we'll see if they settle down. If they haven't, then we'll refer you for investigation. But when I went to the chest x-ray, saw the report of the chest x-ray was horrendous. I've got, so I've got a mass in my upper lobe, but I've got my two lower lobe, the middle and lower lobe in right on flat. I've got pleural effusion. I've got, so, and the way I was referred straight on for a CT scan, so I had a CT scan within 24 hours, actually. But it's a bit more. I went for a chest x-ray at 4 o'clock one day and then had the CT scan at 8 o'clock on the day after that. And the CT scan was even worse. Lymph nodes everywhere. Like things have gone on in the liver and all sorts. So, fairly, which I hadn't been expecting at all.
Then got CT when you feel so well as well, and then you see the.
Well, it's a relatively short illness if you think about it. And it was probably 3-4 weeks, and then got seen very quickly in the respiratory clinic at the local hospital. Biochemical team there, and the discussion we had in the clinic was partly about because obviously they wanted to get a good tissue diagnosis or a good diagnosis of exactly what type this cancer was. They were very confident, given my history, that it would well be, it could well be something like EGFR or one of the other sort of ones which should have a targeted treatment fail. So, so they talked to me about liquid biopsy and saying that they've been part of the trial and now it's become not part of routine practice. And I said, fine, let's do that. But also sort of what the other options were about getting a diagnosis. So it was, could get something from the lymph nodes, but it was may well come back negative, and then you kind of end up not having enough tissue, and you end up with delays. I had an additional delay because I'd had a stroke the previous year and I was on antiplatelet treatment, so couldn't have any invasive stuff coming off that for a week. So the blood tests could do straight away, but any of the invasive stuff had to help wait for at least a week after the outpatient appointment.
That's that waiting, isn't it? That's so difficult when you're just not sure what's happening. You're not on treatment yet, and you're just waiting to find out.
You've got advanced lung cancer.
Exactly.
Yeah.
And each day matters, doesn't it? So every delay that kind of comes into the options you want to avoid, really.
Yeah. And then over the course of, so I had various investigations over the course of the subsequent month. And during that time, my mouth was just deteriorating there, and so I'd gone from being fit and healthy to not being able to get around the house. From the initial sort of chest X-ray CT scan basically to getting to see the oncologist was probably nearly 4 weeks actually by the time I got there. But when I saw the oncologist, they hadn't got the tissue biopsies back, so I've had a blood ultrasound scan, and also because I've got pleural effusion, they got pleural fluid, and that had been sent off for sampling as well. So, and then got a treatment appointment probably 4 or 5 days later, started on treatment, and with automated, and within 2-3 days, my cough had gone, my breathlessness was, So that time made a huge difference.
Yeah. And how long actually after you started treatment? When did your tissue biopsy and your pleural effusion results come back? I mean, had you been on treatment for a while by the time?
I don't know. I haven't had a follow-up appointment with the oncologist since I started treatment. I've been followed up in the clinic. I'm on the second cycle of treatment, so I don't know whether those results are back.
Yeah. I mean, I don't think they are, but it's brilliant that that you were able to get those results back so quickly.
Yeah.
And the thing that's so astounding, and I think the best kind of indication of anything is where, you know, as soon as you started taking that treatment, the osimertinib, and a few days later, as you said, your symptoms started to get better.
My lymph nodes disappeared in a week.
I mean, how incredible.
Yeah.
Yeah.
And that, I'm now, so I've only done about 5-6 weeks into treatment now, and I'm back to doing pretty much what I would do normally. I'm back to sort of doing jumper classes, being out walking.
Wow. So not even, I mean, that's, so the classes are quite full on, so that's amazing.
Yeah, and I've not even had to back off too much. I've been doing plenty of jumping about and wiggling.
Amazing. Well, that's brilliant. Thank you so much for sharing your stories. And I think, I think one of the things that's really important to get across is just how horrendous that waiting for a diagnosis period is. I've been there, Janet, I know how horrendous it is. Mark knows how horrendous it is. Each day, each moment, matters, and all you want to do is get on to treatment and do something about what's happening. And the longer you have to wait, the harder that is. So I think, so important to do anything we can to kind of expedite those results, get them quicker so we can get on our drugs sooner.
Absolutely.
If I was going to ask one thing of what piece of information have you found helpful in choosing to have a liquid biopsy?
I think for me, I haven't had one, but I want one. I didn't know about liquid biopsies when I was diagnosed. It wasn't offered to me. It wasn't a thing at the time that was available on the NHS. So, you sort of just follow the road that your oncologist tells you to follow. As I've become, as I've worked more in patient advocacy and learned more about it, I think seeing its use in other countries as almost standard of care. So, knowing that it's a relatively trustworthy entity, I suppose. Because I go through a lot of conferences as well, and sort of seeing the results from those presented and seeing actually the huge difference it can make in terms of the turnaround time for how quickly you can get results back. So I think that's, I think it's more information, but also understanding that possibly, if you don't have enough ctDNA in your blood, you're not going to get that information. But assuming there is, possibly it's more information which can help, help oncologists make better decisions around your treatment choices, I suppose.
Yeah, for me, my oncologist said, that there's the difficulty with sampling a very small cancer, which mine, when it reoccurred, it was a very small cancer, and doing that multiple times to try and get enough tissue from a very difficult position compared to you may or may not find any circulating DNA. So you may find nothing, but you might. So given that there was difficulties with both potentially for me, having both options. Because the garden took, I think, for 45 days to get the samples sent over, analysed and replied to. Then we always had the physical biopsy as an option after that, which would still only be a couple of weeks to get the results for. So within 3 weeks, we'd have both of those back. But fortunately, the Garden test was able to give a result that showed that showed something could be treated.
I think in terms of the information before you have a test, to be honest, when I went to that first clinic, I was just completely in shock.
Yeah.
So I've got a vague recollection of saying something about a trial and from signing something and having a blood test, but that's about it, really. But I think had that test been able to come back earlier, it was so definitive, because I did have so much, obviously, because I've got so much constant stuff going around in my blood. It was very clear the answer in terms of from that test. If that had come back earlier and I could have not had the EBUS, then that would have been, which was a high risk procedure because I've got low oxygen saturations, got asthma, everything when they actually looked was really inflamed inside my chest. So, So I could have started treatment that bit sooner.
Yeah. Thank you. So thank you all for being here today and joining us on this podcast. I've learned so much about your experiences with tissue biopsies, liquid biopsies. So I am absolutely sure the audience will too, whether they're patients and it will help them in their journey, or healthcare professionals begin to deliver liquid biopsy testings. This is really, really helpful. So thank you all for joining me today.
Thank you.
Thank you for listening to this episode of Genomics Now, a series of conversations hosted by healthcare professionals. The North Thames Genomic Medicine Service aims to complement other genomic-focused educational tools with these bite-sized podcasts. So do visit our website for more resources and updates on genomic-based clinical developments and research. If you've enjoyed this episode, don't forget to share your thoughts and spread the word by tagging the North Thames Genomic Medicine Service on social media.